My name is Catherine Stone, and I am a birth and postpartum doula in the San Francisco Bay Area. And I'm talking here with Wintergreen, who is the director of the Common Knowledge Trust, Birthing Better Birth Skills Resource. And we are going to talk today about the gift of fear in childbirth. This will be one in a series of talks that we will have as friends and women who have worked in birth for years and have different experiences, and we come at this from different viewpoints, yet we agree in the end that birthing skills make a huge difference in the quality of any woman's birth. As you listen, you may think even differently from what we are speaking. Know that skills can still help you. So I'm going to open this discussion on the gift of fear to Wintergreen to begin her comments.
Hi, Catherine. Yeah, we'll do a number of talks about fear in childbirth, how it might hinder, how it helps, or how it may be absolutely neutral. And we chose this gift of fear because has been a message since Grantley Dick Reed wrote his book on childbirth without fear, really, in which people have said, well, the one thing that you can do for yourself is trust birth. Women have always had babies, so don't be afraid of birth. And as the director of the trust and the person who developed these skills with families, I also spent many, many years in third world countries, not involved in birth, but talking to people in cultures where there was no medical care. And what I discovered, and I don't know if I was surprised because I really didn't personally have an opinion about fear when I gave birth. I was highly anxious. When I was pregnant with my daughter, I thought maybe she wasn't going to be right, or what was birth going to be like, or, so I had anxieties. But what I found in traditional communities, which helped me to articulate this to modern people, is that every traditional community is very fearful about birth and actually about pregnancy and about the newborn period. We have to remember that prior to antibiotics and immunizations, we expected to lose around 25 to 30% of our children before the age of 5. What cultures do, which is different than modern people, is that they don't treat fear as sort of a blindness. They treat it as a hypervigilance. And that's why for anyone who's interested in traditional healthcare, they'll find that all traditional cultures have a healthcare system, and they focus a great deal on pregnancy, birth, and the newborn period. And the way that they deal with their anxieties or fear is to tell women when they're pregnant, you can do this or you can't do this, you can eat this, you can't eat this, think this way, don't think this way, do this amount of work, don't do this amount of work, have sex, don't have sex, live here, don't live here. So all of those things are trying to reduce or prevent problems. What I came away with, and one of the things that our trust tries to explain to people through the Birthing Better Childbirth Preparation course, is that it's okay to be afraid of birth. And we want you to be able to distinguish whether that fear is something that needs to be addressed right away. So we invite you to ask this question. If you feel afraid, do you feel that within the next 5 minutes, there is going to be a problem? And if the answer is yes, there is, then seek appropriate help. If you ask yourself the question, do I feel that there's going to be a problem in 5 minutes? And the answer is no. And do you feel there's going to be a problem within the next 12 hours? And the answer is, I think so. Then seek appropriate help as well. If you ask that question a third time, do I feel there's something to be afraid of in 5 minutes, in 12 hours? And the answer is no. Then ask yourself, are you being anxious about something that you need to really pay attention to, or are you feeling an anxiety? All of it's okay. And that's why the families who developed Birthing Better skills came to the conclusion that skills help you manage and cope with those negative emotions. You may still have those negative emotions, and you can focus on your behavior that is coping and managing and dealing and working with them. And that's why one of our resources is a resource called The Positive and Negative Voice that explains the skills around that. So tell me a little bit about your experience with fear around childbirth.
I find that almost all women have anxiety about birth, and understandably so, especially women who are birthing for the first time, but many times women who are birthing for the second time as well, especially if they've had a traumatic first birth and they don't want it to be repeated. There is anxiety, there is fear that something will happen, there are leftover feelings from your own birth. If your mother was afraid when she was birthing you, if she has told you stories about how terrible labor is, if you've heard stories from friends that are negative, if you've watched or read things about horrific outcomes, all of those things can contribute to anxiety and fear that that might happen to you. As a doula, I try to prepare people for birth by educating them on what is likely to happen and also introducing them to the Birthing Better skills so that they have skills to manage negative emotions, and also they have skills to deal with things that could come up in labor. And I find that the more they are prepared as labor approaches, the less afraid that they are. And then they enter labor with very little fear and anxiety, because compared to when they knew nothing, they now know a few things and they feel confident.
Yeah, I look back on the families that developed these resources and the thousands of families that have used them since. There's no doubt that skills make a difference. We all know birth is unknown and that you don't know what it's going to be like. And what skills give people is the ability to say, however it unfolds, I will cope and manage, deal with, and work through what is unfolding as it's happening now. And I think that when we talk about the gift of fear, one is we want people to use that fear that I talked about earlier, that if you really think that there is a problem, then that is a gift to know that, and you should act on it. If you recognize that you're being anxious, that's still a gift. That gift is propelling you to recognize in yourself that you can use skills to cope with what's happening to you or around you. And that's common with people who make birth choices and then those choices don't unfold and they're faced with very different experiences. And those different experiences produce an anxiety. And so what families taught me was that the deeper you use skills, whether it's the directed breathing, whether it's the pelvic clock exercise, whether it's the deep touch relaxation, or making certain that your nonverbal and verbal communication skills are very highly developed, that then you are able to work with what is happening to you, and that your memory after that is more on how you coped and dealt with it than what happened to you or around you. So when you talk about your clients being prepared and having knowledge and skills, with the Birthing Better skills, do you actually teach them the skills or do you encourage them to self-learn the skills?
I always encourage them to self-learn the skills. I'm not here to teach. I'm here to, of course, check on something that they're unclear about. We will go over what they've learned in some of our meetings. And if they can't find a particular bone, if they're trying to map their pelvis, I will help them by showing on my own body where things are. And then they're able to find them on their own bodies. It's like driving a car, no one else can do it for you. This is your vehicle, your body, and you have to learn it yourself. I'm not here to do skills to you. You have to use skills yourself from the inside, because no one knows better than you who carry the baby within you, you who know this child better than anyone, and who knows your own body better than anyone. So who better than you to know what could be happening in any one moment of either pregnancy or labor, and what needs to happen. In labor, sometimes if a woman seems to be lost or confused or momentarily not sure, I will sometimes suggest skills that she might find useful, or ask her, what does she think is needed now? I'm there also to comfort her and remind her that everything is okay. We're usually in a hospital situation. Often we're in a home birth with midwives as well. As a doula, I don't have medical responsibility, but as long as I know, and I'm in close communication with the medical providers at all times, as long as I know that everything is all right, I can reassure the woman and her husband or her partner as well during some of the most intense moments of labor. And as we know well, labor can get very intense.
So one of the benefits is that families who developed the Birthing Better skills wanted to have something to do for themselves. And what you articulated so well was the ability of each of us to internalize our capacity to respond to the situation. And that's also part of that, in some ways, that gift of fear, that gift of response to feelings that you have that might be intense or overwhelming. Catherine, we've come to the end of this conversation. I want to thank you for participating. We'll meet again.
Wonderful, Wintergreen. Thank you for sharing your wisdom.